Hi, my name is Erin Gallardo. I am a physical therapist. I'm board certified in neurologic physical therapy. I'm going to show you some balance exercises today that are going to train the vestibular system. These would be great for a client who has motion sensitivity, who needs to do habituation training, maybe someone who's had a concussion, something that's going to really stimulate the vestibular system. We're going to start with the SlackBoard Pro with 2 lines, and having your client start with 1 foot on the board and 1 foot on the ground stable behind them is probably a good place to start. The first exercise, you're going to have your client with their thumb straight out in front of them. They're going to focus their eyes directly on their thumbnail, and they're going to be rotating their head and arm at the same time. So they're going to rotate about to 45 degrees on either side, nice and slow, keeping that thumbnail in focus and maintaining their balance. The board is going to provide some somatosensory information because it is dynamic and unstable, and they're going to really have to use the vestibular system because now they're also moving their head and their vision is obscured with this movement. So have them do this for a number of repetitions or maybe 30 seconds. And then the next exercise you can have them do is hold their thumb out in front of them and hold that thumbnail very still. And they're just going to rotate their head side to side about 30 degrees on each side. So this is a VOR exercise, maintaining focus of that thumbnail as they rotate side to side. So again, starting position would be good to have 1 foot on the board and 1 foot on the ground, since this exercise can be really challenging on balance and it's really working the vestibular system. A third exercise you can do for habituation and VOR cancellation is with 2 thumbs out at about 45-degree angles, and have your client look with their head and eyes at one thumb and then rotate and look with their head and eyes to the other thumb. Nice and slow, trying to keep those thumbnails in focus with smooth movement of their eyes. So anytime you're doing vestibular exercises and balance exercises, you want to maintain a level of challenge that is not so much that they're falling over where their brain turns off, but that it's enough where they're a little bit wobbly. So maybe a 6 or a 7 out of 10 of intensity level of a stability level. If your client is really successful doing those, you can have them stand on the board with both feet and repeat the exercises that way with 2 feet on. So the first one, tracking their thumb across about 45 degrees from side to side, keeping that thumb in focus. The next one with the thumb straight ahead, and they rotate their head side to side, keeping the thumb in focus 30 degrees out. A little off balance is expected. And then the other exercise with 2 thumbs out, turning head and eyes, smoothly moving from one side to the other.